first started watching the procedure, I realized in such a small area, there's a lot of intricate anatomy, and any little maneuver really makes a big difference. So I think what appealed to me about the procedure is it requires a lot of thought. Not only are you trying to improve the form, but you also have to preserve or improve the function or the breathing. So it's very complicated what really goes on in the nose and what has to be done in the surgery to make things better. The way that I do it, I use an open technique where I do an incision and really just take a look at everything. The most important part of the procedure first is the planning and figuring out what steps need to be done to achieve what the patient's looking for. And there's no cookie cutter approach. I formulate a different plan depending on the patient. Of course, the patient's put to sleep. I do it using an open technique, but now that I sort of have a plan, when I take a look at everything, my plan, I go step by step in a very systematic manner to sort of achieve all the goals that I'm trying to do to improve the final look. About 90% patients are satisfied. The one thing to remember with this procedure is, I always say as a surgeon, I can control the surgery, but the healing process is something I don't control. So all rhinoplasty surgeons, they have 5 to 10% revision rate or patients wanting little things fixed. For the most part, most patients are happy, especially if they have clearly defined goals and the right patient is selected for the procedure. To me, the ideal patient has the appropriate expectations. So if they know what they want and it's something that I can change or modify surgically, and if that sort of meets what they're looking for and it's something that can be feasibly done, then I think it's a good match, or you could say ideal.